Let's talk about how to interpret an EKG. Before we start, it's important to identify the components of an EKG strip. We have the P wave, the QRS complex, and the T wave. First, we need to identify the P wave. The P wave should be present and upright. The P waves should come before the QRS complex, and there should be one P wave for every QRS complex. Step 2 is we need to identify the PR interval. First, let's identify where the PR interval is. Then you want to calculate the PR interval. A normal PR interval is 0.12 to 0.20. Let me explain. A big box is 0.20 seconds, where a smaller box within our big box is 0.04 seconds. So 5 large boxes, 1, 2, 3, 4, and 5 equal 1 second. So now, knowing that information, we can calculate the PR interval. You can see here that we have 1, 2, 3, 4 small boxes in our PR interval. Now remember, each small box is 0.04 seconds. Times this by 4, you get 0.16 seconds. Now, if we look at this compared to our normal PR interval of 0.12 to 0.20 seconds, this is a normal PR interval. Step 3 is identifying the QRS complex. First, we want to evaluate the QRS complex. We want to check whether every P wave is followed by a QRS complex. Now we want to calculate our QRS complex. A normal QRS complex is 0.06 to 0.12 seconds. If we line this out, we can see that we have 1, 2, 3 small boxes for our QRS complex. 3 small boxes times 0.04 seconds, because each little square is 0.4 seconds. This equals a total of 0.12 seconds. If we check that on a normal QRS complex, we have a normal QRS complex. Step 4 is that we need to identify the R to R intervals. First, let's identify where the R's are. Now the QR interval is taking one R and dragging it to the next, and so on. Now we want to check whether they are regular or irregular. This looks very regular, and I'm going to show you what an irregular R to R interval looks like. You can see here that the R to R's are very irregular. We have some R's which are close, and then we have the next R which is really far away. This is irregular R to R. This right here is AFib. But going back to our normal strip, you can see that these are regular. Okay, now that we've determined all these things, we need to do step 5, which is to determine the heart rate. There are 2 methods to determine the heart rate. I'm going to show you both. The first one is called the 6-second method. This is where you count the number of R's between the 6-second strip and multiply it by 10. You need to make sure that this strip is a 6-second strip before doing this. In this case, it is. Okay, now we're going to count the number of R's. We have 1, 2, 3, 4, 5, 6, 7, 8 R's, and when we multiply this by 10, we get 80, meaning this strip is 80 beats per minute. The next method is called the big box method. This is where you divide 300 by the number of big boxes between 2 R's. Okay, so let's count the amount of big boxes between the R's. We have 1, 2, 3, 4 big boxes between the R to R's. Now we divide 300 by the number of big boxes between the R's, which is 4, and this equals 75 beats per minute.